Unusual fatigue or subtle changes in your body might be more than just daily stress. Diabetes often manifests with distinct signals in women. In this video, we'll dive into common indicators that suggest diabetes might be lurking. Understanding these signs is the first step to taking control. So, let's dive deeper. Number 1. Polycystic ovary syndrome, PCOS. PCOS, or polycystic ovary syndrome, is a hormonal issue mainly affecting women in their childbearing years. It often messes with menstrual cycles and can cause more facial and body hair due to high male hormone levels. Here's the twist: many with PCOS also deal with insulin resistance. That means their cells aren't responding well to insulin, prompting the body to produce even more. This overload can push the ovaries to pump out more male hormones. The big concern? These insulin problems boost the chances of getting type 2 diabetes. So, women with PCOS juggle two concerns: handling PCOS and watching out for diabetes risks. Awareness is key. Number 2. Yeast infections. Yeast infections, especially recurring ones, might be more than just an annoying issue for women. Yeast love sugar, and when there's extra sugar in the blood, a common situation in diabetes, it can also end up in the vaginal area, creating the perfect environment for yeast to flourish. As a result, women with high blood sugar levels may find themselves dealing with more frequent and stubborn yeast infections. So, if you're noticing these infections are happening more often or are harder to treat than usual, it might be your body waving a red flag about elevated blood sugar or even undiagnosed diabetes. While not everyone with recurrent yeast infections has diabetes, it's significant enough link to warrant attention and a potential checkup. Number 3. Urinary tract infections, UTIs. Urinary tract infections, UTIs, are infections that occur in any part of the urinary system. While they can affect anyone, they're particularly common in women. Now here is where diabetes enters the picture. Elevated blood sugar levels can increase the risk of UTIs. High sugar levels in urine create a breeding ground for bacteria, making it easier for infections to set in. For women with diabetes or consistently high blood sugar, this might mean recurrent UTIs or infections that are harder to treat. If you're a woman frequently facing UTIs, it could be a sign that your blood sugar is on the high side. While UTIs don't directly indicate diabetes, recurrent episodes might be a cue to check blood sugar levels and consult with a healthcare professional. Number 4. Skin changes. Skin changes can be a subtle hint that something's amiss with your blood sugar levels. One specific change to look out for is acanthosis nigricans, which appear like dark, velvety patches, often unfolds in creases of the body like the armpits, neck, or groin. This skin condition is closely linked to insulin resistance, a hallmark of type 2 diabetes. The body, in an attempt to use insulin effectively, might produce more of it. Excess insulin can then prompt skin cells to reproduce rapidly, leading to these noticeable patches. For women spotting such changes, it could be a nudge to check for diabetes. While skin changes alone don't diagnose diabetes, in conjunction with other signs, they might point towards a need for blood sugar evaluation. Number 5. Reduced sensation. Reduced sensation, often experienced as tingling, numbness, or pain in the extremities like hands and feet, is a potential signal of neuropathy, a condition where nerves are damaged. Diabetes is the leading cause of neuropathy. Prolonged high blood sugar levels can harm nerves over time, affecting their ability to transmit signals. This means that women with diabetes might not feel temperature changes or pain as effectively, leading to unnoticed injuries or infections, especially in the feet. If you are experiencing these sensations, or rather the lack of them, it might be your body hinting at underlying high blood sugar levels. It's essential to address such symptoms promptly, as early intervention can prevent further complications. Number 6. Fatigue. Fatigue, that persistent feeling of tiredness or exhaustion, isn't just a result of a hard day's work or lack of sleep. When it comes to diabetes, chronic fatigue can be a telling symptom. High blood sugar levels can hinder the body's ability to deliver glucose, the primary energy source, to cells effectively. For women, this means even after a full night's sleep, they might feel drained or lack the energy for daily activities. Consistently feeling fatigued, especially when paired with other symptoms, could hint at undiagnosed diabetes or issues with blood sugar management. While fatigue alone doesn't diagnose diabetes, it's a sign worth paying attention to, especially if it's unexplained and persistent. Number 7. Blurred vision. Blurred vision can be a surprisingly sneaky sign of diabetes. When blood sugar levels swing too high or too low, it can affect the eyes, specifically the lens's ability to focus. Here's how it works. Excess sugar in the bloodstream can pull fluid from tissues, including the eyes. This can temporarily distort the shape of the lens, affecting your vision. For many women, this sudden blurriness can be unsettling and might come and go with fluctuating sugar levels. While it's a reversible symptom, it shouldn't be ignored. Persistent or recurring blurred vision, especially when accompanied by other diabetes-related symptoms, might be a signal that it's time to check blood sugar levels and seek a medical opinion. Remember, early detection and management can make all the difference. Number 8. Frequent urination. Frequent urination, especially those unexpected trips to the bathroom at night, can be a telling sign of diabetes. When there's too much sugar glucose in the bloodstream, the kidneys work overtime to filter and absorb it, but when they can't keep up, the excess glucose is expelled through urine, taking fluids from tissues with it. This process triggers increased thirst and, in turn, more frequent urination. For many women, it might seem like a never-ending cycle of drinking fluids and then rushing to the restroom if you find yourself in this loop. It's not just a quirky hydration habit. It could be your body's way of signaling elevated blood sugar levels. Pair this with other diabetes symptoms, and it warrants a quick check with a healthcare provider. Recognizing the signs of diabetes in women is crucial for early intervention and management. It's essential for women to tune into these signs and consult with healthcare professionals when they emerge. Early detection not only helps manage diabetes more effectively, but can also prevent potential complications. So, make sure to watch this video for steps to prevent these signs, and please subscribe to this channel if you found this video helpful. Thank you for watching.